Hora te marino, kia whakapapa punamu te moana, he huarahi mo tātou I te rangi nei. Haumie huie taikie.
Thank you so much, Amrita. So first, I'm going to read the bios of our wonderful presenters. I'm so honored and pleased that they've agreed to share with us the findings from this report looking at future priorities to improve sexual and reproductive health in Kiribati. So first, I'll introduce Dr. Maretta Bastio. She's an independent health consultant in Kiribati, and she's currently secretary for the Parliamentary Select Committee on Financial Support for Healthcare Services. Maretta has a bachelor's of medicine and surgeries and a master's in clinical psychiatry. Her research interests relate to improving care for disadvantaged populations and community, addiction medicine, general mental health, and ending sexual and gender-based violence. With us today, we also have Dr. Elizabeth Popplewell, who has been a social science researcher and evaluator for over 25 years, with the last 10 years focusing on international development in the Pacific. Her fieldwork experience in different sectors has involved successful engagement with a range of stakeholders, including government ministers, senior public officials, public enterprise boards, business owners, community leaders, and community groups. Her recent work in Kiribati projects has included a midterm review of the KHFP Phase 3 and an evaluation of the Kiribati Marine Training Center. I want to welcome you both. Thank you so much for joining today, and I'll let you go, and you just let me know when you'd like to advance the slides.
Slide 2. Yes. Kia ora koutou and Māori. Firstly, we would like to acknowledge Norma, who initiated this research, and her team at the Kiribati Family Health Association. We would not have been able to meet so many people if it hadn't been for the support from the KIFA team. Amrita from Sexual Wellbeing Aotearoa, SWA, who commissioned Future Partners to undertake the research, and she worked really very closely with us through the ethics application process and as a sounding board during the drafting of the report. Last but not least, we'd like to acknowledge the participants, and we would not have been able to have undertaken this research without their insights. So I'll quickly go through the context and research approach, and then Maretta will discuss the findings. Next slide. Okay, for those who are not familiar with Kiribati, it's in Micronesia, and this map shows the scattered geography of Kiribati. Its population is around 121,000 people, and more than half live in Tarawa. That's highlighted in orange on the map. And it comprises of 32 atolls, and around 20 of them are inhabited. Now, the total area is just over 800 square kilometres, and that's dispersed over 3.5 million square kilometres of ocean. So just giving you that geographical context. Next slide, please. So Kiribati faces unique challenges when it comes to sexual reproductive health and family planning. And these, along with the scattered geography, include cultural diversity, underreporting of sexual reproductive health data, and limited healthcare resources. Next slide, please. So this research was commissioned to help inform the next stage of the Kiribati Healthy Families Project, which is funded by the New Zealand Ministry of Foreign Affairs and Trade and jointly implemented by KIFA, the Kiribati Family Health Association, and SWA, Sexual Reproductive Aotearoa. So phase 3 is coming to an end, and this research will be used to identify what resources and strategies are needed to improve family planning and sexual reproductive health initiatives in Kiribati. Next slide, please. So the research objective was to identify priorities to inform decision-making and planning for family planning and sexual reproductive health initiatives in Kiribati, with a particular focus on the outer islands. Next slide, please. Okay, so based on the objective, the budget and time frame, we designed a qualitative approach. And our research report includes relative statistical data provided by the Kiribati Ministry of Health and Medical Services, highlights from the Healthy Families Project evaluations and reviews, and survey data from the 2023 and 2024 Healthy Families Project community surveys that are carried out by KIFA. But this presentation will only focus on our field work, the interviews with key stakeholders and community focus group discussions. So culturally, the northern and central outer islands are quite different. And Maiana and Butaritari were chosen to represent different outer island contexts. Government officials are mainly based in South Tarawa, and so we included this location as well. So the fieldwork was undertaken in July and August of 2024, and the research was completed, and the research report was completed in November 2024. Now, the budget meant that travel could only be to 2 outer islands, and with only 1 researcher going to Maiana and Butaritari. Next slide, please. Okay, so KIFA and SWA had planned to visit Maiana and Butaritari in July and August last year. And so we organised the fieldwork to coincide so that Mareta could accompany them. We knew it would be very important for community engagement if Mareta could be introduced by KIFA and SWA. So in total, we engaged with 25 people across these 3 locations. Next slide, please. Okay, so the research examined 4 areas, and we worked with SWA and KIFA, and they confirmed that the research would focus on these 4. Alignment of the Healthy Families Project to government priorities, changes to sexual reproductive health and family planning services in Kiribati over time, gaps and challenges to current services, and needs and priorities for sexual reproductive health and family planning services in Kiribati, particularly the outer islands. Now I'll pass you over to Mareta, who will discuss the findings by these 4 areas. So that's the next slide, please.
Mary, can you all hear me? Okay, greetings from the hot sunny Tarawa, and like to acknowledge the opportunity as well for this great opportunity in sharing our the research that we have undertaken. So on the research findings, as you know, the KV20 is Kiribati's long-term development. It's a blueprint for the period of 2016 to 2036. And our research confirms that KIFA plays a vital role in the community. It delivers several sexual reproductive health and family planning services in the community through the Kiribati Healthy Family Project and its other initiatives. Closely, aligning with the government of Kiribati's priorities. And this allows the Ministry of Health to focus more on the secondary care and also part of the primary care. For the health activities, a focus on highly skilled workforce, so this is important, and it should be accessible and affordable quality health care system. This slide also shows that in the KV20, one of the government's priorities is to reduce the country's fertility rates. With the stakeholders, also thought that KIFA's objectives and KIFA's activities closely align with the government priorities for a healthier population. They refer to how KIFA is delivering on the government priorities through working within, Kiribati culture and the different religious denominations, which is very important in the Kiribati context. They also referred to KIFA's work with government agencies, and that's one is with the Ministry of Education, training teachers on sexual reproductive health in secondary schools, also assisting the Ministry of Women, Youth, Sports and Social Affairs, which is known as MWISA, by providing relevant information to help them with their own programs. So stakeholders also acknowledge that KIFA collaborates within the Ministry of Health to deliver these age and family planning services in the community, and allowing the Ministry of Health to focus more on the secondary care, as I've mentioned. So next slide, please.
Has it come up for you, number 2?
Yes, okay. So just with sexual reproductive health and family planning services, they're changing over time to respond to the different and growing needs in the community. Stakeholders are referred to outreach mobile services and after hours services. And this is important because they reach some marginalized groups. They also said that growing demand for the outer island services to help women access family planning services, and for the community to access the SRH information that they need. Some also noted that KIFA is engaging more with different Kiribati traditions and religious denominations within the different communities and the outer islands. And this is very important, as I mentioned earlier. They noted that KIFA also provides youth programs, including training for peer groups on SRH and workshops for church youth groups. Stakeholders also commended that KIFA adapts its services and training to suit the different, and when I say different, it's the extreme differences in the culture and practice on different islands. We can probably discuss this later on, and the uses of different approaches to deliver sensitive information. They also added that community access to information and SRH and family planning services through mobile and after hour clinics is important. Again, to re-emphasize important to the marginalized people in the community. Next slide, please. So that's, we are on the gaps and challenges. There was a recognition that key Ministry of Health and medical services.
Sorry,
and
can I interrupt you for a second? I think that, sorry, it's just a bit difficult to manage this. I think that there was 2 slides for your second section, so I will let you speak to the second slide for the second section. Sorry about that.
Right.
Are you
So
saying?
I think, yeah.
That's slide 12, Marita.
Yeah, that's slide 12. Okay. Yeah. Yes. So there was a recognition that key players, the Ministry of Health and KIFA needing to work more closely and better coordinate activities to ensure that SRH and family planning services are regularly accessible, regardless of where people live in Kiribati. And also stakeholders noted that KIFA is working more with Ministry of Health to deliver sexual reproductive health and family services in the community. We've already mentioned KIFA's work with MHMS, or Ministry of Health, and the MWISA, that's for Ministry of Women, Youth and Sports. Another example provided referred to KIFA's review of the Ministry of Education school curriculum on family health. KIFA is also working more with local authorities and island councils so they can advocate for broader community well-being to bring outer island services to help women access these services and the community to access the information that they need. Yeah, so now we are, the next slide, please. So if I'm correct, we are on gaps and challenges. Yes?
Correct.
Okay, so while the current services are addressing the needs of most key groups, the increased demand, imposing significant financial constraints in providing SRH and family planning services more broadly. So the challenges include infrequent and irregular visits by KIFA, and these are, mostly voiced by the respondents we interviewed, and government agencies to outer island clinics, and shortage of family planning commodities on these islands. They also identified a lack of dedicated services for hard-to-reach groups, such as sex workers and the rainbow community. There's also lack of KIFA branches or hub dedicated to outer islands, and with most of them responses, most of the people wanted a specific branch for KIFA on the island. Yeah, and a lack of support for modern family planning methods from some religious denominations, in particular the Catholic Church, and this is an important area that KIFA is, facing, struggling to address. There's growing misinformation, challenge within the community, especially the outer islands. Example, cervical smear causing cancer. So with the responses, people need to be well informed with these health issues, and getting the correct information. Yeah, next slide, please. So you can see the location with the islands and the relevant gaps and challenges in terms of sexual reproductive health and family planning. For Mayana, it was lack of privacy and access to services. So here, when people come to the Maniape, it's an open area and it's a public place. So this is where the outreach or the clinics are conducted by nurses. So there's lack of privacy. There's also poor coordination planning between the Ministry of Health and KIFA for outer island visits. Trust issues with government-run clinics, and I think this mostly related to out-of-stock commodities, and materials and supplies that are needed for sexual reproductive health and family planning. And the radio messages not focusing on the emotional aspects. So this is quite important. And this came from an educator in Mayana. And then she felt that this was missing from the health promotional materials. For Putaritari, it was lack of involvement by other stakeholders, spreading of misinformation, lack of professional development for government nurses. And this is sometimes the nurses, they rely on medical assistants who are more trained and capable to carry out certain procedures. And these are important so that they work together to address family planning and sexual reproductive health issues. There's also lack of pamphlets for people who stay home and who do not attend workshops. So for South Tarawa, it was the lack of initiatives on the prevention of maternal deaths during the pregnancy and during the birth, growing demand for sexual reproductive health services on Tarawa. And also KIFA's inability to gather data on its services to help with its planning and funding. There's no regular training on cycle beads, contraceptive. And as mentioned earlier, this is the only acceptable method that the Catholic people approve of. So if there is any training conducted in their maniabe, they allow only this method, but it needs to be consistent and regular. Stakeholders also noted that some religious and community leaders still lack the knowledge, and there's also lack of targeted workshops towards men. This is very important, noting that the level of male violence against women and children, increasing. And most of the time, in regards to this point, it's always the women and the youths who come forward, to attend, whether it's training or clinics. It's mostly the women who come. And so these are the suggestions that came up. Yeah, I think, next slide, please. While acknowledging that KIFA is already doing a lot, stakeholders said that there was still more to do. And this could involve a dedicated hub for the outer islands to reduce travel costs and improve frequency and reliability of visits. So regular connection with the outer island councils and collaboration with Unumane. So this is important. The local government, for outer islands, it's important to connect with the outer island councils. And then for each island, it's different. The Unumane is the other strong body that, in terms of cultural aspects. So Unumane is important. And considering the other bodies that are also, they play a big role in the community, and that's the churches as well. Improved notification of visits to outer islands. This is important information to be relayed to the island council, and ample time is needed in order to, because the islands are such that it can be a small island, but it's quite long, and the villages are scattered throughout that long strip of island. So sometimes it's quite difficult to gather everyone at one place. So improve access to remote service, and this is more online and audiovisual phone. That some islands have Ocean Link, and some have both Vodafone and Ocean Link. So some islands they use only Vodafone, some islands only use Ocean Link. So this is the other area that needs to be improved. The continued capacity building on sexual reproductive health and family planning, it needs to continue, and this is very important. Continuity of medical supplies on the outer islands, that's a big one. Access to hard to reach, and including the sex workers and LGBTQI plus communities. Next slide, please. So some insights from the focus group discussions we had, and as you can see, youth spoke of the positive changes in their lives, is attending the KIFA workshops and hearing about the services available for them. This increased knowledge has meant a better understanding of their bodies and how to protect their body from STIs and unplanned pregnancies. Also, with the increased knowledge comes feeling of empowerment. However, when asked about any challenges, they commented on lack of regular services on the island, lack of regular online access for information, lack of privacy with government clinics, opposition by some denominations, particularly the Catholic Church, to modern family planning, and difficulty reaching KIFA because of the phone services on the island. Next slide, please. So those who use KIFA services also spoke of empowerment. They know how to protect themselves and look after their children. And education and awareness of their bodies, and help to better space their children and have access to contraception, and also having access to these services means they can have cervical checkups. However, when asked about any challenges, they commented on lack of medical supplies again at the outer island clinics, and sometimes contraceptive supplies run out. So government of Kiribati deals with a range of health issues, and KIFA's focus is sexual reproductive health and family planning. So prefer to see KIFA for family planning and sexual reproductive health services. So mostly people tend to have more trust on KIFA than to the government clinics. And this is one of the most of the respondents who shared their views. Next slide, please. So for young couples, the women and men were separate. So women spoke more of feeling supported by KIFA staff, increased knowledge and being empowered, improved well-being of their family, with ability to better space their families. There's also improved personal health through cervical checkups and STI testing. But some commented that their weight increased from the contraceptive they were using, or that their husbands were reluctant for them to use contraceptives. They thought that contraceptive might encourage them to be unfaithful. So these were some of the concerns of the couple. Men overall, they said overall, as sexual reproductive health education is good for their family. They know how to plan their family and can go for checkups. However, they spoke of government clinics running out of supplies and a lack of ongoing education in how to use the cycle beads contraceptive. Yeah, so this is an important area, especially for the Catholics. Next slide, please. So for this community, they said they have been positive changes in their lives and increased knowledge from workshops that they've attended. They also felt that more empowered, knowing how to better protect themselves. The appointments are usually confidential, and that's how they prefer that. Although KIFA services and workshops are very helpful, they would like to see targeted outreach services, including home visits, and advertise the free KIFA phone number to call. That would be, good for them. Education, awareness, workshops on sexual well-being tailored toward their community, and also improve distribution of condoms, demonstration leaflets, information on workshops on condom use. And this is very important. So it's very clear, especially with the demonstration. A lot of cases that they do not follow as, advice. Better communication about what upcoming education workshop will cover, and advance media notice promoting workshops. The human rights education workshop towards these communities also important for them, and better discreet access to the KIFA office or access to KIFA services from other venues that they regularly use. They have a designated staff coordinator for their community to make it easier to engage with KIFA.
That's me coming in. Next slide, please, Ragnar. Okay, so in conclusion, sexual reproductive health and family planning needs will continue to grow and change. However, demand is placing pressure on current resources, and any delays in core funding could disrupt the continuity of services. The Healthy Families Project plays a vital role in the community, allowing the Ministry of Health to focus on primary and secondary care. And KIFA is an effective brand, but as the demand for regular sexual reproductive health and family planning services grow, KIFA risks overstretching its capacity and losing its reputation and community trust if it cannot keep up with this demand, especially in the outer islands. Key players and funders will need to work more closely for innovative and cost-effective solutions to meet the different sexual reproductive and family planning needs in the outer islands. And KIFA will need to explore new funding sources to meet the increasing demand, expand capacity, build resilience, and ensure the sustainability of its services. So the next slide, please. So we divided our recommendations into strategic and operational priorities. So I'll talk about the strategic priorities, and then Marita will discuss the operational ones. So for longer term decision making, We recommend that strategies to improve family planning and sexual reproductive health initiatives will need to involve more frequent visits to the outer islands, and this could involve either increasing the number of visits from South Tarawa or establishing a kifa branches on the outer islands, or creating a centralised hub specifically focused on the outer islands. And the hub could be based in South Tarawa or on one of the outer islands. Improved communication between the Ministry of Health and kifa regarding visits to the outer islands, including providing longer advance notice and better coordination. There's an opportunity for them to also collaborate on exploring affordable transport options to the outer islands, along with expanding services. Specialised services for marginalised groups such as sex workers and the LGBTQIA+ community. And further research focused on prevention of maternal deaths during pregnancy and during birth, as well as research to better understand the sexual reproductive health and family planning needs of the southern outer island communities. Now, I'll pass you on to Moreta, who will discuss the operational recommendations. So that's the next slide.
Thank you, Elizabeth. And lastly, on the operational recommendations, we recommend that to improve the operation of kifa's work, resourcing is needed. For the development of kifa's database to record services and patient data, new social media approaches for education and awareness campaigns, and more visual aids to help in appointments with patients, providing access to a free equine and better online access to information, including an online audiovisual platform. Also, the installation of condom dispensers to make it easier for you to discreetly access condoms. And we note that exploring affordable transport options to the outer islands, along with expanding services, expanding the clinics, whether in South Tarawa or on the outer islands, for example, at youth centers or secondary school campuses, or adding extra clinic days, we would require nursing staff, along with continual supply of commodities for the clinics. And I think this is the last slide. And thank you. Kambrapa, if there are any questions.
Yes, thank you so much to both of you. I really appreciate you walking us through how you gathered this information as well as what you found. I think it's really exciting and helpful to sort of look at all of these different dimensions and how they intersect and what can be done to really systemically address these problems. So thank you so much. I'm going to open it up to the group for questions. I'm going to stop sharing here so we can see one another. And if you want to just either raise your hand with the react button, or if you want to turn off your camera and raise your hand like this, you're welcome to do so, and I'll manage that. Any questions for our presenters? Okay, well, none are coming. Oh, Roy, yes. Hello, thank you. Go ahead.
Hi, Maori, Kamraraba, Mirita and Elizabeth for your presentation. My name is Roy, and I did some volunteer work in Kiribati a couple of years ago where I was based with AMAC. So we did some work with kifa. And so I saw firsthand the amazing work that kifa does, particularly their youth group and the way that they engage with communities to be able to talk about some really sensitive topics and issues. My question was around traditional knowledge and cultural practices related to sexual and reproductive health, or even menstrual health, and if this came up at all in this particular research or even in the work that kifa does out in communities. Kamrapa.
Moreta, would you like to speak to that, or Elizabeth?
Moreta, you can answer that one.
Yes, thank you, Roy. Sorry, I the sound, because internet is not. So could you please just repeat?
That's okay. My question was around traditional knowledge and cultural practices related to sexual and reproductive health, or even related to menstrual health. And if that's something that came up at all in this particular research, or even if that comes up in the work that Kifa does, particularly when going out to outer islands or working with communities.
Yes, so with going out to communities, it is important, especially on the topics around sexual reproductive health and family planning. These are quite sensitive topics for various islands in Kiribati, in the southern part of Kiribati. You will need a different approach when implementing the activities around this around this area. Usually they're quite conservative people. These are the islands of Tapito, where and you have to it's more like a tiptoe approach. What you communicate, you really need to strain your words well to the community. Make it simple and not to be offensive, because they're quite sensitive to these topics. They're quite strict, and this is one of the challenges as well. As compared to the central part of Kiribati, Mayana, Putaritari, and also the northern part of Kiribati, they're more flexible. And when you share, this is what came up from our visits, when you share, and even from Kifa, that when you share scenarios or around this, and people laugh, that's sort of normal. So when you talk about the body, this reproductive health system and everything, that's quite acceptable, and it's normal for the central part of Kiribati. They use it together with their language, and the topic is quite acceptable from the elders to the old to the young. Yeah, so they can laugh about it. They can make fun of the other friends. So it's quite a flexible and more relaxing approach. But the Tapitoe and the southern part of Kiribati, that you really need to the way the presentations, how you speak in the Maniape, and you cannot just share maybe some similar message that you presented and shared in relation to the topic sexual reproductive and family planning, to make them better understand that. So it's quite different, and they will take it differently. So that's one big cultural aspect that Kifa is facing. And I know that our research is also, we just focus on Mayana and Putaritari, and we have not been to the other part of Kiribati, which really will give you the holistic, view of the cultural perspective from Kiribati as a whole. So I hope that answers your question.
Thank you, Roba.
Thank you very much. Does anyone else have a question? Okay, I have one. Actually, I have a lot, but I'll refrain from going into too many. The first is really sort of thinking about the theme of this series that we're running is about sexual and reproductive health over the life course. So I'm curious for you, Nareta, if you could speak to sort of how things have changed over the last couple of generations, or if there has been a change, how the older women and communities might be affecting the attitudes, or how they might be changed by, new practices today with modern contraceptives. But could you sort of speak to that relationship between knowledge sharing between the older generations and the younger?
Yeah, thank you for that question. With time and with the older generations compared to the youths, like I said, Tarawa, it also depends on the location and the places where they are. So in the outer islands, it's more people are more, there's respect and they uphold the their own cultural practices. And in the Kiribati context, the young girl is very important because they need to keep themselves well. They have the first period, the Menaki, that they celebrate. So that's a cultural significance in the Kiribati culture. And they wait until they are married, and usually it's a big celebration if they are virgins during the marriage. So that's the family pride. So culturally, over time, that's still the same. There are certain factors and movement from the outer island to South Tarawa. South Tarawa, you can say South Tarawa is like from Panape, and to the whole of Kiribati, because all of them are on South Tarawa, and a whole, a lot of factors that come in. So some, with the older generation, they keep that, and they usually that's the older generation's perspective in regards to in addressing sexual reproductive health. So for those who are educated, the youths, they're accessing the services, and those who are undergoing problems, relationship problems, they're utilizing the services that they understand now, that they know about, and keeping up with the time and what's available. I think with the education that they learn, but at the same time, on the other hand, they try to keep their culture, but that they know these are the services that are available, and that if they need to access, they can access. So there's with the cultural perspective and also what's available to support them, there's an understanding throughout the age group, for the older women as well as the youth, and also with the regional religious perspective, for the Protestant and the others. I think mostly the Protestant, they accept and they allow any trainings, any talks, health talks around sexual reproductive health to the community. They allow this. But for Catholic churches, they limit. And then, usually they would vet the presentations. And then these are the things that we allow, and these are, that we don't allow. So they stick to the natural ways. And I think there's a need for more of this bead cycle, because that's acceptable to them, but there's a need around the training, more of training, to be consistent and regular, and that will respect their beliefs well, respecting the communities and the ideas of and the choices of the community. So I guess it's working both ways, and people with a cultural perspective and strong cultural practices and beliefs. That's the foundation. And with this sexual reproduction, the modern medicine, they accept depending on their religious beliefs and and the new developments of the healthcare. Thank you.
Thank you so much. That's really elucidating. Are there any other questions for our presenters? Okay, well, I'm going to ask one more, just because I was really curious about this. You spoke when you were describing the locations, specifically the need for, in Mayana, the emotional aspects to be included in those radio messages. And I thought that was really fascinating, this sort of specific calling out of the fact that there's not as much attention on what I would imagine is sort of the relationships as well, and sort of how to manage relationships or how to have healthy relationships, or seeing maybe if something is not good and kind of getting that. Am I capturing that? Did I understand that correctly when you spoke to the emotional aspects of the messages received? Is that what it's about?
Yeah, I guess it's trying to recall this came from the educator herself, and she thought it the awareness, the education, radio educational awareness and materials that were shared, more focused on the physical side. But the emotional aspect of it, like probably the counseling aspect, or when somebody, if they're able to address that on, so I think that was coming from that her role as an educator. So I think it was the experience that she had. One of her students encountered a similar issue, needing psychological support, and they feel they also need that capacity, to be able to address these issues when they arise at the outer island level. Yeah, they hear about it, if you need, use condoms or sexually transmitted diseases. But it's probably when somebody has these symptoms or these issues, where can we go? How can we be, help? So I think there's a need for more, collaboration with probably the mental health department of Ministry of Health, and that can be worked out from there, what needs to be, what can Kifa offer, because they are doing a great job, great work towards addressing the youth issues. And we cannot ignore this. This is important. It's I think the most important. And coming from my personal perspective, I think that was a great response coming from her.
Yeah. Well, thank you so much for that. Yeah, the intersection of sexual and reproductive health and mental health, I think, is so important and often really overlooked. So we've had a few messages in the chat that I just want to highlight, of people giving their thanks and also saying how informative and interesting this has been. And I want to echo that. Thank you both so much for taking the time to do this, and thank you to everybody for joining us today. And as I said, please keep an eye out for future webinars, and I will also be sending out a link to this webinar recording if you want to share it with anyone who you think might be interested, as well as a link to the report, which is absolutely available on our website, on Sexual Wellbeing's website. There's Elizabeth holding it up. Unfortunately, it's blurred, but it is a beautiful report and super interesting. So Thank you again, and hope that we see you all back here at another time, and have a lovely day. Oh, and let me just say, oh, sorry, Elizabeth. Yes, what would you like to say? Oh, okay. Sorry, I almost forgot. Rita, could you please do our closing karakia?
I absolutely could. I also just wanted to say thank you again to Elizabeth and Merita. I'm utterly biased because I was involved very closely with them in the process, but it was a huge undertaking and a massive challenge to get this research project off the ground. So thank you. I know it's been almost a year, but it feels like yesterday. I'll close us now. Ka whakaira te tapu, kia watea ai te ara, kia turuki whakataka ai, kia turuki whakataka ai, haumie huie taikie.
Thank you, everyone. Ka kite.
Thank you. Rapa support.
Thank you. Bye.